Good morning, Kansas City. We're here live at the University of Kansas Health System, here to answer your questions and give you our unfounded and hopeful, but actually founded and hopefully semi-expert opinions about things related to the coronavirus crisis here in the United States. I'm here with a couple of colleagues, Dana Hawkinson, who we've now dubbed Dr. Hawkeye on the ride, our medical director of infection control, and today we also have Tiffany Horsley. Tiffany joins us. She's one of our infection control nurses. Does a great job helping us work with this population of patients and really all things related to infection control here at KU. And Michelle, our interpreter today with sign language. So thank you all for being part of our show this morning. Dana, first thoughts.
First thoughts, we are still seeing very high numbers of coronavirus infection in the United States. There's still been a lot of deaths. I think we still need to continue to maintain very good hand hygiene and maintain social distancing. And we really, at some point, would like to see the light at the end of the tunnel. Maybe by the end of this week, we'll have a lot more data to suggest where we're going and how we've been doing the last 2 weeks.
Yeah, I think the end of this week will tell an important story for where we are on that curve. So far today, our number of positive patients at KU is sitting at 33. We have 9 patients on ventilators. We've had a few people come off successfully, and we are really pleased about that. Tiffany, thoughts that you have just to start the morning in infection control. What's important? What's not? What's true? What's not?
Hand washing is always important. It's the #1 way that we can prevent the spread of infection. And so as often as you can, clean your hands. It's effective to use hand sanitizer. It's also effective to use soap and water if that's available to you.
Thanks so much. All right, well, here's my opening thought. It's early, but so far we're still in the first inning, but maybe we've scored a run. So coronavirus may be up 2-1, but we're making a comeback. So that's going to be our message for today. Questions that you all have out there?
Hi there, this is Denise with KCTV5, and I wanted to ask about, I'm working on a story about a woman that is battling cancer right now. And what are some of the challenges faced by cancer patients during a time like this?
You bet. Dana, from an infection control standpoint, what do you think are the biggest challenges? Again, infectious disease.
Yeah, we still don't know how this disease interacts with fully with people who are immune suppressed. In general, though, especially with respiratory viruses and infections, patients who seem to be immune suppressed certainly seem to be more at risk of further disease as well as more complex and critical disease. So it's always good to maintain the things that we've been talking about, hand hygiene. Certainly discussions with your medical team is very important. But yeah, in general, the immune suppressed we think are certainly at higher risk, as they have seemed to be at higher risk for many other infectious diseases as well.
Tiffany, any thoughts from your standpoint?
I know that a lot of people are concerned if they do need to go out into public, and the CDC has recommended that we use some masks when we're going out and about. And so, it's really important that we properly use our masks.
So, one thing I would say around cancer that is a special challenge, we do know that cancer patients are at risk for a worse outcome than some of the other disease categories. Really, it's heart failure, COPD and asthma, people with underlying autoimmune disease, transplant, cancer patients. And one of the challenges for cancer patients is that you can't always stay home when it comes to going to the doctor. Because of the nature of the disease, you do need to have routine follow-up. You do need to have CT scans to measure the tumor progression, as an example. And you have to keep on top of getting your chemotherapy and your radiation therapy. So whereas some patients, for example, lung transplant or heart transplant, you may say, okay, we're going to keep you at home. Harder to do that, especially with cancer patients when they're in the middle of therapy. They have to continue, and so they're going to expose themselves a little bit more. So I think cancer patients and cancer programs in general have to really work very specifically on some measures of infection control to try and prevent the spread. And one of those things, one example has been making sure that patients go directly from their car into the exam room and they do not pass go, or whatever it is in Monopoly, that Monopoly term. I kind of messed it up there, but you know what I mean. And so I think there are special things we try to work on with our cancer population.
Okay. Is there any particular advice you would give to like a caretaker? Because you have to be so careful around a cancer patient if you're helping them anyway.
Oh, you do.
it's just presents such a challenge, I would think, for those families.
Boy, you're absolutely right, and it is one of the hardest ones. Mostly the key, I think, and you guys comment, but I think the key is if you're a cancer patient, you have to make sure your caretaker is symptom-free, has no fevers, no chills, no signs of being ill. And if they do, instead of trying to be a hero and saying, I'm going to work through it, you have to be a hero and say, I might be sick. And it's funny because so many of us are wired, especially I think in healthcare, to just push through it. That's what we've been taught forever, right? We're just going to push through it. But the problem with this is pushing through may really endanger someone. So I think the real key is to identify when you're sick, don't touch your face, do all the other things you're supposed to do, wash your hands really well. But don't try to push through if there's even the faintest hint of being sick. I think that's probably the best advice I can give, guys.
Yeah.
Sure, yeah. Staying home when you're sick is actually how we care for people.
Okay.
This is Taylor, Channel 41. I've got a question about the mask as well. I'm a middle-aged guy with kids at home, staying at home, that kind of thing. If I choose to not go to not wear a mask when I go to the store, who am I most endangering? Is it the people at the store? Is it me? Is it my family? Who am I most putting at risk if I make the decision to not wear a mask when I go out and go to the grocery store?
Tiffany, infection control principle, who are we helping here?
I think that actually you could be putting both at risk, both yourself and others. A lot of the masks that we're using for the general public is to help control the source of the infection, which is if you happen to be an asymptomatic carrier, you could be shedding virus and sharing that out to other people. But as well, if you're unable to maintain an adequate social distance of at least 6 feet, you could be putting yourself at risk for being exposed to someone else as well.
You know, Dana, I've read this weekend that up to half of patients may be asymptomatic carriers. Did you see that? And I mean, that's really the tail of the tape for why you should wear a mask in public.
Yeah, we certainly know there's been asymptomatic people or pre-symptomatic people, so many people may be asymptomatic for a little bit of time before they do get symptoms. There is probably that small population that won't get any symptoms at all. That's not too inconsistent with what we've been saying. However, it looks like now you can probably be more, and there probably is more spread of the disease than we thought of initially for people who are asymptomatic at the time or pre-symptomatic. And that's really the goal of the face masks, is to help somebody who may be asymptomatic or pre-symptomatic from spreading unknowingly to other people.
Yeah, I think there was an article today in the New York Times that referenced some work being done by some researchers out of Texas suggesting that 70 to 80%, I think that's the right number, of counties in the United States already have an established coronavirus epidemic within their county, and largely driven through the asymptomatic portion of this disease, and that's going to spread it before people are ill. Hence the reason to wear masks if you're going to go out in a place whether you're in public. So comment for just a moment, if you're walking at Loose Park and there's no one else around you, do you need a mask on, versus I'm at the grocery store?
No, again, I think if you're in situations, if you're outside, likely if there's any spread or coughing or sneezing, that's probably going to be dispersed in fairly low concentrations pretty quickly. It probably doesn't pose too much of a risk. Certainly in confined areas, stores, things of that nature. Obviously, if you're coughing and sneezing, there's going to be a lot of viral particles that are coming out with that. But in general, yes, you're probably going to be more at risk in those confined areas, such as stores or other places where other people are, compared to being outside.
And you're touching things that other people in the store are going to touch, right? I'm going to do some bananas. I want grapes. I want to touch every grape to see how, if it's a good grape or a squishy grape. And, stuff like that could get you into trouble, squishy grapes. Next question.
Hi, guys. Jessica McMaster with 41 News. Now that we know that this virus has jumped to animals, to a tiger, what does that tell us about the virus? Anything?
Well, I mean, it came from animals to begin with, so I don't know that it changes a lot. But Dana, there is that story coming out of was it the Philadelphia, New York Zoo? I don't remember which zoo it was. Yeah, where there was a tiger that may have had it, but bats had it before that.
Yeah, this is really an interesting story. It's not too surprising, though. I think we need to calm everyone down. We do understand that these viruses can jump species. That is nothing new. We've known it for influenza. We've known it. Influenza jumping from pigs and ducks and other animals. We've known that this virus is probably from another species as well. There are viruses who jump species, I don't want to say all the time, but all the time, it is quite frequent. It is known. It's not surprising that this has been found in another species, i.e. a tiger at this point in time. Even the CDC guidance for people who are self-quarantined or self-isolated, they do stress, if you do have pets, try not to take care of your pets. Try to have somebody take care of your pets for you if you're able to do that, because we just don't know. Certainly this is more evidence that it can jump species. Now, what is the full effect when it does jump the species? Who knows? But the concern is that it can always jump species, maybe interact with other viral DNA, and then change or shift in that way as well. So it's not surprising that it's been found in another species at this point, especially what Dr. Stites said. We knew that it probably jumped from a different species to begin with. But this is more evidence that we really need to be careful around other species, other animals, even possibly our home pets. But we still don't know the full impact of what that means at this point with this virus.
So Dan, I'm sort of attached to my dog and my cat, both named, by the way, after former Star Trek characters, just in case anybody wondered. But do I need to be worried about them?
Yeah, I wouldn't say worried as much as, again, take some caution. There is certainly direction from the CDC urging that if you know that you're ill, if you cannot take care of your animals, or if you can distance yourself from them, it may be a good idea, because we don't know yet.
Other questions?
Hi, this is Melissa with Channel 41. I have a quick question. Positive and negative with Missouri peak now looking like it's stretching to late May versus Kansas, which is still looking like it's late April.
Yeah, I'm not sure we really know those curves yet in Kansas. I think we're going to have to figure that out, and I think part of it is, and Dana can comment, and Tiffany, whether or not Missouri did as much socially distancing at first, it's going to be a little more rampant into the population. There's a higher rate of rise. They also have more testing in Missouri than they've had in Kansas, so I think it's a little hard to know yet. Mm-hmm. And I think most of the things we're seeing in Kansas are pushing the peak more into really the first part of May now, and as we get more data, remember Kansas is kind of on the flat part of that curve. It hasn't really hit the more rapid ascending part. And again, our limited number of tests make it hard to know the exact penetration in the public, and the fact that there's a pretty profound effect from population density. We don't know. If you look at the heat map right now, Kansas is really kind of centered around Kansas City and the counties here. There's one other county that had some nursing home issues, Sedgwick County down around Wichita, but it's starting to spread into Kansas. So that whole peak for all of Kansas is going to look a little funny, because the density is so much less out west that it's going to rise more rapidly more in the urban areas, and then it's going to slowly rise out in the western counties. So I don't know for sure when that peak's going to be. In Missouri, it may well be in mid to late May, but it's also a little bit more concentrated population in Missouri. Dana?
Yeah, and especially, we are very linked to Missouri. We are separated by a street, essentially. So even though their data may suggest something else, we are so closely linked to them that it's hard to really say. We know that Mayor Lucas was pretty proactive, even if the governor's office wasn't. He was pretty proactive in starting shelter at home or social distancing. So that may have helped, but we are so closely linked to Missouri on the western side of the state of Missouri that it's really hard to say what the difference is between Missouri's numbers and Kansas numbers. And just as Dr. Stites said, we know that there's other cases moving west in other counties that are now probably having cases of
most
coronavirus.
counties probably have it. It's just asymptomatic still. The other thing, in the absence of really good testing, then what you're left with is hospitalizations and ventilators, and then you try to impute how many patients are out there with it. And so we watch those curves, and those curves are 10 to 14 days delayed from what the testing curve would be. And so we are going to be delayed in that. Tiffany, anything else from your standpoint?
Sure. No, I think that, that's everything that Dana said is accurate. That we have had some challenges with having enough testing supplies, and that's something that Governor Kelly has been working very hard on to, so that we can do some widespread testing and actually have a better idea
Yeah.
of what our numbers
Of where
really
we
are.
Yep.
So I'm not sure we know when we are, but we'll know more by the end of this week, I think especially in the Kansas City area, because we're going to figure out a little bit better where we are in the curve.
Can
Next
you tell us,
question.
as far as wiping down your things and sanitizing things go, a lot of these products have to, as I understand it, be left on a surface for a certain amount of time before you wipe them back up
Yeah.
to actually disinfect. Can you speak to that a little bit?
Tiffany?
Sure.
Yeah, absolutely.
Yeah, so we call it the contact or the dwell time, and I like to say the dyeing is in the drying. So once you apply a sanitizer, a disinfectant to a surface, you need to make sure that you use enough that the surface is visibly damp, and then you want to let that dry. And each product has a little bit different time. You can usually read on the product instructions what that time is. The purple top wipes that we use most often here in the hospital have a 2-minute contact time, but different products have different lengths. And you can read the instructions for each one, but it is important that you follow that drying time to allow all of the pathogens on the surface to be killed.
So what was that? What was that? Drying time is dying time? Is that what you said?
The dyeing is in the
The
drying.
dying is in the drying. I'm going to use that. That's pretty
let's
good.
take it.
I'm not
Take
sure
it.
I've heard that before.
We need to get the message out.
All right. Next question.
So again,
Okay.
Dr. Sykes, you seem a bit more upbeat this week. Maybe it's because it's Monday. I don't know if you got
Maybe.
some rest. But is there something to that? Are you feeling like people are starting to take the stay-at-home order more seriously? Are you seeing improvements within the hospital, or am I misreading that altogether?
No, you know what? A weekend can help rejuvenate you. There's no question about that. I watched some good shows this week. I watched the things with Tom Hanks and Mr. Rogers. That was great, and you kind of get recharged when you get to do good stuff, and that helps you a little bit. I am cautiously optimistic about the curve in Kansas, and again, we'll know more later, but it's cautious optimism that may totally be well-founded, not be well-founded, because I tend to be a rose-colored glass kind of guy, and so I'm trying to look at the data and saying, gosh, we have 9 ventilators today. We had 13 on Friday. Even if we're on some part of the limb, that feels good to me. But it's still really early, and I don't want anybody to take away too much from that. I just think it's really early, and I think that's probably it. I think it's a little bit of sleep and a little bit of that, and I think all of us, and we appreciate y'all so much. I know people always wonder, what's your relationship with the news media? The reality is, you guys are our messengers right now, and it's so important for that relationship to prosper. And I think if as leaders, we have to be able to demonstrate a sense of hope and optimism, because coronavirus is tough, right? These are tough times, and I've not lived through a pandemic, and I have every intention of living through this one, and I hope that all my friends and family do. But it's going to touch all of us, right? It's going to touch all of us. And we have to choose how to respond to that. My mother died when I was 19 years old. I was changed forever. My father, when I was 34, I was changed forever. And I'm 60, and now we're in this pandemic, and somehow it is going to touch us all, and we will be changed forever. And we have to decide how we're going to live through that, so that we can live on the other side of that. And I think it's a choice as most and as best as we can make it. And so we have to choose to beat Corona, and we're going to do that. We are going to do that. And we're going to beat it by the actions of every person every day who decides to shelter, wash, not touch their face, keep their distance, wear a mask in public, and do those things we believe will help us get to the other side.
I would like to add, even if it's with the rose-colored glasses, but even if it turns out that certainly our data coming in the next few days shows that we are on a plateau right now, we're not seeing an increased cases, it still takes personal vigilance and responsibility, because all it takes is one gathering of 5, 6, 10 people, or a celebration, or some sort of thing like that, where then you have 2, 3, 4 people who are infected, and that can spread exponentially. And so it still is going to take vigilance right now. And hopefully we will still be able to do that. Hopefully we are on a plateau, and maybe we're seeing a decrease in number of cases, but there's still a lot of work to be done.
Constant vigilance. Tiffany, any other word you would describe with that or phrase?
I just think how fortunate we are that to be living in this time and this the advances that we have in technology, that I can have a Zoom coffee meeting with some of my friends just to have that socialization. That I have all of the internet of Netflix and Hulu and HBO on demand to be able to keep myself and my kids entertained. And that we're very fortunate that we can maintain our relationships, because I think our relationships and the care that we have for one another is what helps us to sustain through this time of isolation.
All right, questions?
Can I pop in? It's Amy at Channel 5 again, and ask a quick question about masks. And it seems like maybe an odd question to ask, and I can't see you right now, but we're rolling on this at the station. Can you show us the right way to put on a mask and take it off, and what do you do with it once you've taken it off?
Tiffany, you are so prepared for this.
I came ready.
All right, let's do this.
All right, so it's
We
really
call it
important.
donning and doffing. D&D.
Yes, donning and doffing. I heard a funny saying once. I was like, "Who's don PPE?" PPE is personal protective equipment, and a mask is part of it. It is very important that we properly don and doff, or put on and take off, our personal protective equipment. And so always, the number one thing that we want to do is clean our hands first. And so you would always dispense a little bit of hand sanitizer and make sure that you clean your hands. Same with our cleaning products. The dyeing is in the drying, and so you want to just rub that in until it's completely dry. Okay, then you want to use your mask. Now you may have a medical grade mask like this, or you may have a cloth mask that someone has made. I've seen a lot of different patterns going around. Often they'll have a nose piece, and so you can tell this has like a little formable bendy piece right here at the front. That's the top part that's going to go over your nose. And so you want to loop this up over your ears, down under your chin, and then form that over your nose. So that's kind of sealed there on your face. Make sure that the nose is not exposed. I see a lot of people wearing it down under their nose. That's not appropriate. It needs to cover completely your nose down to underneath your chin. Once you've put this into place, don't touch it. The outside of the mask is the part that becomes contaminated, and so if you're messing with it, touching it, you're potentially contaminating your hands, where then you could touch your eyes or surfaces with a contaminated hand. So once this is in place, if you're at the store, you just leave it in place the entire time and don't touch it, don't move it around. When you're ready to take it off, remember, you've been touching things and your hands may be contaminated. And so before you take it off, you want to clean your hands again. Make sure that that dries. Once you're finished with that, you'll just loop up around your ear, and you want to take this away from your face. Don't touch the outside. This is the part that's contaminated. Just hold on to it by the ear loop and discard it into the trash. One of the things I've seen sometimes driving around, there will be masks laying on the ground in the parking lot, or gloves laying on the ground in the parking lot. A big piece of infection prevention is cleaning up afterwards, and so make sure that that goes into the trash. And once you've completed discarding your mask, clean your hands again.
Well, I like that.
was
Making
excellent.
sure you have to pick everything up and throw it away. My kids, I should have taught them a little bit better on that one.
Some people don't know that, yes.
What about homemade masks?
So we've had a question about homemade masks. Those can be made with a variety of different materials. Some of them are made with filters. There's not a lot of studies to support that those are great for protecting you, although they will, depending on the fabric that they're made of, prevent some contamination. What they do help with is if you are shedding a virus, they can help you to keep other people safe. And really the same rules apply for putting them on and taking them off. You want to start with clean hands. You want to put it in place and leave it in place. You want to clean your hands before you take it off. And instead of discarding it because it's cloth, you'll be reusing it. Place it into a plastic bag to save until you do your laundry, and then wash it with regular detergent on a normal laundry cycle. And make sure that each time you take it off, you're getting a clean mask to put back on. You don't want to put back on a dirty mask. You want to wash it in between each use.
Next question.
That was awesome.
Yeah, well done.
That was awesome.
I learned something.
Good.
Yeah, clean up after yourself. Next question. Are there any other questions? You know, one of the things I am always struck by is some of the human spirit, especially when you watch the scenes coming out of New York and Detroit and other urban areas. And I have no doubt that Kansas Cityans will respond the same way should the coronavirus crisis reach that point here. So important to maintain that open level of communication with everyone. So we're going to keep coming right back to this table throughout the week in order to establish that relationship and make sure that people know we're continuing to fight and encouraging everyone to still carry on. Dana, as you look at the next few weeks, what do you forecast?
Yeah, I'm hoping we are starting to get more information. I'm hoping if our hospital is any indicator that we will maybe see a slowing of the infections. I think it still is too early to tell, but I think everybody is doing great. We have to remember this is not just a physical virus, but an emotional and a psychological virus too. It's affecting so many people on so many different levels. We are lucky that we can come in here and interact with people. A lot of people can't go to their jobs, can't see their friends, maybe can't even see other loved ones because they're in different households. But we have to continue to be vigilant. With any luck or optimism, we can certainly, in general, around the area, start to see slower numbers of infections and less critically ill, and hopefully come out sooner than we had anticipated. But I think it's still going to take a lot of work on everybody's part, and I think for the most part we are doing a lot better, and everybody's doing a very good job in trying to do their part.
Yeah, I think that's true. Tiffany?
Yeah, I think that, this is definitely interesting time. I hear a lot of, especially young adults who are maybe just out of mom and dad's house, really struggling with not being able to see their family. A lot of parents who are healthcare workers struggling to not see their kids. And I just try to keep the message that the work that we're doing by staying home is so important. And it is how we are caring for other people in that time, that staying home is caring, and it is important work.
That old saying, absence may make the heart grow fonder.
Mm-hmm.
Absence may also help keep the heart alive.
That's right.
Yes.
Be a good thing. Any last questions? Well, I think my final thing for today is that you've heard us say it before, and it's still really true. Sheltering in place, washing your hands, keeping your distance, not touching your face, coughing to your elbow. Those are the things that will help us get through this and get to the other side. Allows us to flatten the curve, allows us to not stretch our healthcare resources so badly that we can't stay in front of this. And most of all, it helps us stay alive. So until we hear you again and talk to you all again, this is our team here at the University of Kansas Health System. We'll see you tomorrow morning. Thank you very much.
Thanks, guys. Appreciate it.